Experts consider bariatric surgeries, also called weight loss surgeries, to be an effective way to control the weight of severely obese patients that are at a high risk of developing serious health problems due to the excessive weight. But it's important for patients to understand that bariatric surgeries do come with risks. All bariatric surgeries are major procedures, and no procedure is without risk or potential side effects. Some of the short-term risks include acid reflux, anesthesia-related risks, chronic nausea and vomiting, inability to eat certain foods, and infection. The long-term risks for bariatric surgery will vary on the kind of surgery, but include dumping syndrome, a condition where food from the stomach is dumped into large intestines without proper digestion, low blood sugar, malnutrition, vomiting, ulcers, and hernias. These risk factors often push patients to consider alternatives to weight loss surgery that are less risky and less disruptive to one's quality of life. We will go over some of the alternatives. However, this is for informative purposes only and should not be considered medical advice. Consult your healthcare provider before starting any new weight loss regimens. With that said, here are the 4 best alternatives to weight loss surgery. Number 1. Diet and exercise. Yes, if it's been said once, it's been said 1,000 times. The best way to lose weight is through diet and exercise. In fact, for bariatric surgery to even be considered, the patient needs to have tried to control his or her weight with diet and exercise without success. Even moderate improvements in one's diet and exercise level can have massive improvements in weight loss. Because of its effectiveness, low cost, and accessibility, it is the gold standard for weight loss. However, it isn't easy. This is partially due to conflicting and confusing information about nutrition. But it's also because it requires one to break decades of bad habits. This brings us to our next alternative: counseling. One of the biggest reasons that people fail to see results with diet and exercise is that they self-sabotage their efforts. This is almost always subconscious, and it's the result of some past trauma that has led the patient to have unhealthy beliefs about themselves. For example, a survivor of sexual assault could develop an eating disorder to subconsciously make him or herself less attractive as a way to avoid another assault. Counseling and therapy can help identify and break down these mental blocks. Hypnosis. Most people only experience hypnosis as an entertaining stage performance, in which an all-too-willing volunteer embarrasses themselves by acting like a chicken. But clinical hypnosis is another form of hypnosis, in which hypnosis is used to treat psychological and physical problems. Clinical hypnosis is practiced by licensed and trained professionals as a way to break bad food habits. This can be very helpful in removing the desire to eat junk foods and eliminating any aversion to exercise. And contrary to some beliefs, most insurance providers in the US cover hypnotherapy at least in part. Natural weight loss supplements. Weight loss supplements can be a bit controversial. While many people swear by their effectiveness, there are countless others who view them as dangerous at worst or ineffective placebos at best. A lot of this comes from weight loss supplements manufactured outside the US, with questionable production standards and dangerous and unnatural ingredients. However, by choosing to use all-natural weight loss supplements made in FDA-registered facilities in the US, the use of weight loss supplements can be very effective. The concept behind these supplements is to use natural herbs to boost metabolism, curb cravings for unhealthy foods, and boost energy. Countless people have found success with natural weight loss supplements, so even if their effects are a placebo, the results are still there. If you are considering weight loss supplements, we have links to 3 quality weight loss supplements in the video description, so be sure to check it out. We hope you found this video helpful. Please be sure to like the video and subscribe to the channel for more health-related videos.